Ladies and gentlemen, I come here to you once again in front of my camera to my views. I have a very fascinating story here that involves an incident that happened yesterday, and it's something that we're going to explain to you, and you have got to understand because it is involving inexperienced quack doctor prescribing expired medication to an infant that was ill yesterday. She has a story. How are you?
I'm good. How are you?
I'm very good, thank you. What is your name?
My name is Lucy.
Wow, that's fantastic. What happened yesterday? Because you narrated to me something you experienced that is not good. What was it?
Okay. My daughter has not been feeling well for a while, so I took her to the clinic yesterday in a government hospital, and then the doctor checked her, and she was having fever, and the fever was too high because it was 40%, 40 degrees. And they were like, no, we're going to give her medication, and then you're gonna wait outside for 30 minutes, and after 30 minutes we're going to check how she's responding to the medication. And they did, and I waited outside. After 30 minutes I went back, they checked her again. It was dropped to 38.5 degrees, and it was still high. So they were like, no, the way it's going down slowly, I think she needs an injection. So my worry is, let's cut the story short. My worry is, after everything was done, they gave even my daughter 2 injections, and then the fever started going down like slowly. It was not going fast. So my worry is, when they gave me the antibiotics, they said, we're gonna give you antibiotics to take home and some painkillers. And then they gave me the painkiller, which is this one. It's called Ibusin. And then for this one, okay, for me or for everyone, as everyone knows, we trust our doctors almost like everything. After prayers, we trust them 100%. You will never go checking whether the medication they give you in the hospital, they are expired or not. But for my surprise, I happened to check the medication they gave me. The antibiotic is this one. Here is the antibiotic name. Everyone who is reading this, or any medical doctor who reads this, can understand. It's an antibiotic. It is in a powder form. They always give you, they tell you that after you reach home, you put water up to that line and then you shake it well. But after I shaked these antibiotics, I'm surprised. I'm like, no, antibiotics is not this light. This one is light, too light, like almost like water. Antibiotic, at least after you dilute it, it's at least thick. So this one is too light. I got consent of checking the expiry date, and here is the expiry date of the medication, which is January 2024. That means the medication they gave me was expired 3 months back. And then now my concern is the injection they gave the baby, that they still use the same medication they have in the hospital. At least this one is not expired. It's expiring on December 2025. But having one medicine that is expired in your category of medication, is it safe for our kids? How dangerous is it to give a child an expired medication and prescribed by a doctor? If I bought it from a chemist, it was going to be something else. I got it from a government hospital. Okay, I'm not gonna say the place that I am at for my security reasons. I'm not gonna show you the baby for her security reasons also, because the video might go viral and tomorrow I might go to the hospital again and they might say this is the baby. So I'm not gonna include all those things. But for you to get a medication like this, an antibiotic that expired 3 months back, how dangerous is it for our kids? How dangerous is it for our lives? And then how do I know that all the other medications she got yesterday, even the injection, because it's a mixture of different medications that they indicate in the child, how do I get to know that it was not expired? Guys, let's be cautious when we go to the clinics, when we go to the hospitals. Anything they give you, any medication, let's check the expiry date, because if I never check the expiry date, I was gonna feed my baby all this suspension that is expired. I don't know what is going to do more harm, or what harm is going to do in her body after consuming and expired medication. Let's be careful. Let's always check our expiry dates, especially when we get medications from government hospital. I don't know, it's negligence, it's ignorance, or even her, she didn't know, but she is responsible to make sure that everything that is coming from their wardrobes, from their cupboards, it must be 100%.
Now, which country are you in?
Me, I'm in South Africa.
Are you a citizen or non-citizen?
I'm a non-citizen.
Do you have good experience of being in this country? What do you say? What's your opinion? And particularly in medical field?
Yeah, I have a good experience. Before, I have never experienced this, but I have never been concerned to check the expiry date. I don't even know what got into me for me to check this expiry date. So we don't know how much medication we have already consumed in our bodies that is already expired. That's my concern. We are victims of expired medication in government hospitals. Why are they still in the shelves? Why are they still on their shelves? Why are they still keeping? Is there no one who inspects? Are there no inspectors to check how long the medications are going to take before they expire?
You have heard it from the horse's mouth. That is exactly what happened. I don't think I have anything else to add to that. She explained her experience, and that is horrible to have quack doctors who are unable to treat the patient with the right prescriptions. Watch part 2 of this story. We will leave it at that. She's heading back to the hospital with the child to look for the doctor who prescribed to her the medication that is not right. I want her to give us 2 words that she thinks are vital before we close down the show. What are your last words?
I don't think I have anything to say, but I would encourage every medical field or any doctors in the medical field to check, to inspect their wardrobes, to inspect their medications before they come. They must check how long are the medications going to take before they expire, so that when they're keeping them in their shelves, they'll know that this medicine is expiring this month, so we can start with this one that are expiring fast, and not just take the stock and keep it there and pile it there. Sometimes people, they go to the hospital and they don't get medication. They tell you to go and buy this kind of medications, but they have them in their shelves. They're expiring in their shelves. It's a bad experience.
Fans, I would like to hear your comments, and like the video and share, and keep on watching. We wish you good times. We'll come back in the next 2 to 4 days. Follow this story, and maybe you'll have the same experience and you'll know how to go about it. Have a good day.